If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org.
Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us, as always, is the Executive Director for the National Association for Continence, Sarah Jenkins. Welcome, Sarah.
Thanks, Bruce. It's so great to be here.
Yeah, we're looking forward to this one because today our guest is Laura Kaiser. She is a doctor of physical therapy and the Director of Clinical Strategy and Global Health at Axena Health. For more than 15 years, she's been a physical therapist and a public health professional with a clinical expertise in women's and pelvic health. So welcome, Laura. Thank you for joining us today.
Thanks. It's great to be here.
Yeah, we understand that you have some very interesting perspectives on women's health, not just here in the United States, but globally. But before we get to that, maybe you just want to share with us a little bit about your journey to today, how you got into physical therapy and your current position.
Sure. Thanks. So I've had a bit of a varied career, but I would say sort of a common theme, as I describe kind of my history here, has been a real focus in rehabilitation. As you said, I'm a physical therapist by training, as well as a focus on capacity building in women's health and maternal and child health. So in addition to practicing clinically in the United States, I've spent a great deal of time working in the context of global health, primarily in sub-Saharan Africa. But really in both settings, in the US and abroad, I've been kind of struck by the immense unmet women's health needs, both broadly and, specific to pelvic health. And so that really led me to pursue my master's in public health about 10 years ago. And that kind of marked a pivot point for me. I'd been seeing patients one-on-one, in the clinic full time for a long time before that. And I felt like I kept seeing the same stories over and over again. And I just really had this urge to find, more scalable ways to help more women, because it felt like the waiting list just got longer rather than shorter, as we were building capacity, to deliver one-on-one care. So I got my master's in public health and really began to focus on this kind of scalability. And my interest in digital health was kind of peaked at that time. And around that time, I was also introduced to the Leva Pelvic Health System, which is the main product that Axena Health offers. So it's a kind of a digital therapeutic device that helps to treat urinary and fecal incontinence in women.
So that's very cool and really fascinating. So where in sub-Saharan Africa have you been?
So I actually lived and worked for 2 years in the Democratic Republic of Congo, kind of in the eastern part, right on the border of Rwanda. And I was actually nested at a local hospital at that time, working for a nonprofit organization that was supporting really a variety of rehabilitation programs. We were kind of developing a curriculum and obviously delivering care and mentoring local clinicians. And as I said, kind of that was the time when I really started thinking kind of at a systems level of, how do we deliver rehabilitation care? How do we address women's health care? Not just, at the clinic level, but kind of putting all those pieces together. I've done a lot of work since then in Congo, kind of going, coming and going on shorter trips, but we've expanded some of our work to Rwanda, Nigeria, and Kenya as well.
And when was this in particular that you've been doing this work?
I started my work in Congo in 2009, lived there 2009 and 10. And it was in teen that I developed a really strong relationship with a nonprofit organization that's called Engender Health. And they were doing a lot of programming around that time in fistula care. So obstetric fistula is a really devastating, maybe perhaps the most devastating birth injury that a woman could experience, where really there's kind of a hole that develops in the wall of the vagina and the bladder, or sometimes the rectum, and it leads to continuous incontinence. Obviously, physical therapy won't fix that. There's usually surgery that's needed, but you can imagine the extent of rehabilitation that may be required for women that are experiencing that. So I was kind of wrapped into the work that and the projects that were going on within gender really for the last 10 years. I still have a great relationship with them.
That must have been particularly satisfying, I can imagine.
Absolutely. Definitely challenging, but very satisfying and really exciting to see an organization prioritize rehabilitation. We often, especially in these types of settings, of course, there's life or death issues that need to be addressed, but it's, as mortality has declined, we see this increase in morbidities and things that, conditions like incontinence that could be amenable to rehab. So it's just been wonderful to see, a nonprofit organization emphasize that as well.
Now, forgive me for possibly demonstrating my geopolitical ignorance, but if I'm not mistaken, so you were there well after the end of the Rwandan genocide, but it's my understanding that there's still a very significant issue regarding refugees and camps, and I'm wondering if it was that something that first of all, am I correct? And was that something that you were encountering as well?
Yeah, great. Thank you for that question. So you're right. I was there certainly years after the Rwandan genocide, but there is, and it really has been an ongoing active kind of conflict or political unrest in kind of the eastern region of Democratic Republic of Congo, right on that border of Rwanda. So there certainly were a lot of displaced people. We saw this rise in the condition fistula that I mentioned, also sadly a rise in sexual violence and conditions like that because of all of that unrest going on for so long. You can imagine there's a real breakdown of the health care system. And so, both your basic, health needs are not being met, as well as, everything that's going on because of the conflict. There's so many needs to be met there. But yeah, it was really one of the most incredible experiences of my life to be, living there and really was kind of the impetus for kind of how my whole career has unfolded since then, having this real global perspective on healthcare.
That's it's both fascinating and encouraging and motivating. So I love hearing that people who are willing to, really sacrifice all of the things that we sometimes take for granted here to go out and do good for people. So I really appreciate and love hearing that. But our audience does tend to be an American one. So I did want to come a little bit back around to talking about the United States and your experience in how you see urinary incontinence affecting women here locally. So can you tell us what you see from the way women encounter, face, and try to deal with their incontinence issues?
Great question. I think there's a lot of variation. I think while pelvic floor disorders and urinary incontinence has been in the media a lot more in the last, say, 5 to 10 years, and I think more women are talking about it, I still think there's a real, I don't know if stigma is the right word, but I mean, certainly there's stigma, but still a real normalization of incontinence as something that just happens to women, especially if they've had a baby, and that's really been persistent, even in spite of these news media articles that are coming out to highlight pelvic floor issues among women. So I think because of that, women are still really not seeking treatment in droves. When you look at sort of the prevalence of women living with incontinence and compare that to who's getting treatment, there's a massive, massive discrepancy there.
Yeah, and stigma is certainly the word that we use because it's true. And you're right. You see plenty of commercials and you see plenty of products that have helped people feel a little more comfortable talking about it. But I'm sure that in your experience, if it's like the experience that a lot of the professionals we speak with, is that still people don't want to talk about it.
That's
And
exactly it.
yeah, and I'm wondering, as a physical therapist, are most of the patients you see people who come in there specifically because they're having incontinence issues? Is it because they sort of think that they know something is wrong? How do people get to you in the first place?
That's a great question. So I would say there are some women, certainly there's always, a small number of women that are really empowered. They go online, they figure out, physical therapy is a great option. I have incontinence. I'm going to be proactive. But I would say that's pretty rare. And really what I saw, particularly when I was in clinical practice at Hopkins for a number of years, and it took women years to get to me. They may have gone through a number of providers. They may have tried a treatment that didn't work, but then they never followed up to find a treatment that does work. And often by that time, women have other issues too. So maybe it started with urinary incontinence, But, kind of as with any sort of injury, right, or kind of insult, right, to our bodies, if we don't address it right away, other things can happen. And so you can develop maybe fecal incontinence, maybe pelvic pain, maybe some sexual dysfunction issues. And so often I would see women that took so long to get to me that we had a long list of things that we needed to address. And I don't want to say not just incontinence because I don't want to minimize the experience of incontinence, but sort of my point being that we could have addressed some of the issues much sooner and prevented a whole host of other problems from developing if women just got to treatment sooner.
That sounds so incredibly familiar. Sarah, refresh my memory. How long do we say that from our surveys we found it usually takes women to go out and actively seek help?
Yeah, our surveys and in just general research, we've seen about 6.5 years, which is just heartbreaking that women are living with this condition for so long when there are so many treatments that could help them and make a real difference.
So you're talking about women who, when they come to you, often have additional issues that are either stem from or somehow related to the initial incontinence issues that they were having, or that just sort of also happen to be developing as time goes by. So when you see these women, how does the evaluative process go to sort of help identify all the different things that may be going on and developing a plan to address them?
So I think a lot of where we would begin with physical therapy is, listening to really what brought that patient into sitting right in front of me. Often, because it's been a long journey, maybe 6 or more years, there's a story, right? There's a story there that helps us kind of, trace what's been going on, what's been tried, and even starting to get back to, maybe how did this problem start? Was it an injury at childbirth, or was it something that happened a long time ago that's really just been progressing over time, or is it a new onset of something? So we'll often do really, really in-depth history taking and a lot of education upfront. Many women don't know what pelvic floor physical therapy is. And so it's, my job to help them understand, really the breadth and scope of my practice and help them understand what we can do as an evaluation. We are, physical therapists sort of all have similar training, before we might specialize. So we're going to look at the whole body. We may look at, the low back and the hips and things like that. And then we often will do an internal exam of the pelvic floor muscles if the patient is amenable to that. And then from there, we kind of put all the puzzle pieces together and then devise a treatment plan, really based on what's bothering the patient the most in terms of her symptoms.
So if I am one of those people, or if we have one of those people who really isn't sure of what a pelvic floor physical therapist does, after you've had that initial evaluation, what does a pelvic floor physical therapist do?
So we can do a variety of things. We have most PTs, I think, have a wide toolbox of things to try with patients. So for urinary incontinence, really the kind of gold standard treatment for that would involve pelvic floor muscle exercises. So kind of a training program to strengthen those muscles, develop coordination, maybe develop even the ability to relax those muscles, right? So a muscle has a variety of functions, not just kind of bulking and getting stronger. And so we'll often put together a program to help women train those muscles, as well as deliver kind of a variety of sort of lifestyle interventions or behavioral interventions, if you will. Things like talking about fluid intake, the types of fluids that are consumed, and the volume of fluids that are consumed. We might look at diet if dietary triggers seem to be linked to, maybe urinary urgency, for example. We might talk about weight management or smoking cessation and kind of, general things that may also be helpful for their incontinence.
See, that's very cool because I would imagine if you were to ask most people, they would think that a physical therapist deals with physical stuff, your muscles, your tissue, and that's really it. But so your scope goes well beyond that.
Absolutely. I think, especially in this space and the pelvic health, where there's such, even among the smartest of us, we don't know a lot about the pelvic floor. It's not something we're learning. It's not something that's really, we're exposed to. So I think the education piece is so crucial.
Now, speaking of education, I would imagine that you spend a lot of time talking about pelvic floor muscle exercises, Kegel exercises, and things of that nature. And I also believe that it's one of those things that most people who are listening to this today will have heard of, but a good number of them are afraid of because it seems like some weird mystery, and they may have heard that they're hard to do, they're impossible to do, you can't do them right, it's a pain. Maybe you could tell our listeners who might be holding those feelings the truth about Kegels.
I would love to. Thank you for that question. So I think you're absolutely right. A lot of women or will either say, they don't know what they are, they don't know how to do them, or they tried them and they didn't work. I've heard all of those many, many times. So really the gold standard for incontinence treatment would be supervised pelvic floor muscle exercise. So getting to a PT or using a device or, some kind of home device like, the company I work for, we have a device that allows women to do this at home. There's other products out there as well. But something that really helps a woman know that she's doing those exercises correctly is important. So it can be your PT, or as I said, maybe your physician. She may be able to help you, instruct you in that exercise program. But they are really hard to do on your own. So don't be afraid to ask for help from your doctor, your physical therapist, things like that. That said, with the right instruction and supervision, there's great data to show that about 60 to 70% of women with incontinence, or I should say people with incontinence, will have symptom improvement if they do those pelvic floor muscle exercises, those Kegel exercises correctly and with enough kind of dosage, right? So it takes about 8 to 12 weeks to kind of develop coordination, really, of any muscle and develop strength of that muscle. That's why if anyone's been to physical therapy for another issue, a knee issue or a back issue, you're often in PT for about 8 to 12 weeks. And there's kind of a physiologic basis for that because that's about how long it takes our mind and our muscles to kind of learn that coordination and to get stronger.
I think that makes perfect sense because we're talking about building muscle, and the same way that people who go to the gym build those muscles you can see. This is just a group of muscles that are a lot harder to see. So
Exactly.
it makes perfect sense that you would have to dedicate some time to get it right. Now, before I go on, because I did want to start to ask you about Leva and some device assistance, but Sarah, I wanted to ask you if you had some additional questions that we should be asking regarding physical therapy and things of that nature.
Yeah, the only other thing I wanted to see if you could touch on is some of the other things besides just incontinence that patients with a pelvic floor disorder might be experiencing. I think people think incontinence is the main one, and it certainly is a big one, but like I know back pain and constipation and all these other things can be affected by your pelvic floor, which is why it's so important to take care of it. So could you speak a little bit to that and what, if women are noticing some of these things, it might be a good idea to get them checked out?
That's a great question, Sarah. Yeah, absolutely. And I guess I'll backtrack just a bit to, as I was talking about kind of our physical therapy evaluation. And, when I educate patients, I'll often have, a pelvic model with me. And I'll often say, I know you're here for, bladder leakage issues, but I'm going to ask you about bowel issues. And I'm going to ask you a little bit about sexual health issues as well, because all of those organs sit very closely together. The pelvic floor muscles are, closely related to their function. And so it's important to kind of understand what's going on, throughout the pelvic floor. So we talked a lot about, bladder issues that could be there. Certainly bowel issues, fecal incontinence or bowel leakage is associated with also having bladder leakage. So those two things can go hand in hand. And on the flip side, we also see constipation as well. So that's something that many physical therapists can work to treat. And then, pelvic pain issues is really a broad category of symptoms that could be related to things like endometriosis, maybe, post-cancer treatments, things like that. So there's, a whole range of treatment options for women that are dealing with pain issues. One other thing I'll add is, PTs can be really useful during the pregnancy and postpartum kind of phase, both to help with, pelvic floor health, but general musculoskeletal health and ensuring, women stay active and, reducing back pain and hip pain and things like that.
Yeah, that's great. Thank you. I know so many other countries make that such a priority after childbirth, but the US does not. So,
Absolutely. I know. Hopefully we'll change that one day.
no, I hope so.
So you did mention a little bit earlier about devices that could also assist you in strengthening your pelvic floor muscles. And you have a personal, particular involvement with the Leva system. So I wonder if you could tell us a little bit about how they might be helpful as well.
Yes, absolutely. And obviously, will own my bias since I do, work for the company and was very close to building this product, Leva. And essentially, I came to doing this because, as I mentioned earlier, I had a long wait list of, trying to deliver one-on-one care. And I also knew that a lot of women with incontinence just weren't getting care at all. We mentioned earlier, it takes 6 or more years to get to treatment. And some women just never get there, or there's places where there are no physical therapists that could provide treatment. So all that said, I was very interested in leveraging smartphone apps and digital health. And then I was introduced to Leva, which it leverages both smartphone, app kind of education and things like that. Also pairs with a device that uses motion. So it essentially detects the movement of the pelvic floor, and it can give real-time feedback about what the pelvic floor is doing when someone's doing their exercises. This was very intriguing to me as a physical therapist. I had been familiar with other types of biofeedback that are out there. There's kind of pressure, and then there's electrical activity, what's called EMG. And those were kind of the two types of devices that had really been around for decades. And I would use them sometimes, not all the time, in my clinical practice. This motion based mechanism was really interesting to me because I'd never seen anything like it. And of course, as a PT, I'm a mover and I'm interested in how things are moving. And so that piece of the technology was very compelling to me, enough to bring me, from the clinic to really work on developing this product. Another interesting feature of this is that the device is used in standing. So many women or men who are used to using pelvic floor kind of trainers and devices probably are used to using them lying down. And so I thought this was so interesting to get someone standing up and practicing exercises and in the position that they're most likely leaking, right? So it's a real functional approach to rehabilitating those muscles. Since the product's been developed, we've actually done quite a bit of research to really show that the product is effective. And we get great feedback from our patients, both on the kind of the device component as well as the app component. Really helps to deliver all that education that I was describing earlier. There's a lot of tips and tricks, what we call pelvic health fun facts, and just information for women to to use to improve their pelvic floor health.
Now, is this the sort of thing that a woman might just, who's maybe listening to the podcast now decide, hey, I'm going to get this, and just, you go online, you go to the website and do you need a prescription? Should you do it under the guidance of a physical therapist or a physician? What would you recommend?
Great question. So it is a prescriptive device. So you would need to go to your doctor or nurse practitioner or whomever to get a prescription. We do have a website which I can, of course, leave with you that would link to a prescription form. If your doctor is not familiar with Leva, we can certainly send information to them. And there's also an avenue to do a telehealth visit if you're interested in getting Leva. We are very eager to push for insurance coverage. We have some coverage now and are expanding. So, the long-term goal is really to have this covered by all the major health plans. We're not quite there yet, but we're getting there.
That does take time, and
It
it can be
does.
challenging.
Absolutely.
So tell me, do the folks at Axena have any clinical data on efficacy? How well the Leva system works, and perhaps what patients might expect to see from a results perspective?
Yes, I think that's one thing that really sets our company apart is that we're really committed to data collection and to publishing on our results. So we have a number of publications at this point. We conducted a large randomized controlled trial where we compared Leva users to women who are doing sort of Kegel exercises on their own at home, which is a kind of what we would consider maybe standard care at this point. So we compared those two groups. We had about 300 women, so approximately 150 in each group. And we were able to show that both groups did improve because we know that Kegel exercises do work, but the group that used Leva, improved significantly greater, and their results lasted at 2 years. So they were instructed to use Leva for 8 weeks. They had the option to continue to use it, but we're able to look at the user data over time. Very few women actually did use it after that initial 8-week treatment, and results were still durable at 2 years, meaning they did not need to go back and use Leva to continue to have those improvements in their symptoms. We saw early results. So women in that trial saw results as early as 4 weeks. They saw about an 80% reduction in leakage episodes. So that was great. And then we use a lot of validated surveys that are very common in pelvic floor research. And so we used those to also track outcomes over time. And we were able to show significant improvements there. Similarly, we use those surveys in our app. So all of our real world users are filling out those same surveys that the women in our clinical trial also completed. And we just published a paper on almost Leva users showing that about 74% experienced some kind of significant improvement in their symptoms. So we looked at a couple of different surveys in that study. So we're really seeing fantastic results.
That's got to be incredibly encouraging. I mean, you're talking about 8 weeks and you get 2 years worth of relief for those people for whom it works. And relief is up to an 80% reduction in symptoms. I mean, that sounds like it's life-changing.
Absolutely, absolutely. I think it is. And yeah, I think many women are surprised at how, once you kind of get over the hump and you engage and are committed to this treatment, it really is it's an easy to use, at-home device that you can, and it really optimizes your ability to execute on these exercises. It's hard to do your exercises at home, and sometimes you go to PT and they give you this long paper, but we've really, really tried to kind of streamline things with the device and the app so it's really, really usable and accessible for women.
If I'm intrigued now and I want to learn a little bit more, where do I find you online?
Sure. So you can go to our website. It's levatherapy.com. That's probably the easiest place to go to find information. There's information there for patients. If there's any clinicians that are listening, there's also kind of a whole section there for clinicians who are treating patients with incontinence.
And that's Leva, Leva therapy.com, correct?
That's correct. Mm-hmm.
Outstanding. So, Laura, as you know, this is Life Without Leaks. And one of the things we always like to ask our guests before we leave is if they have one little bit of advice, a hint, a tip to help our listeners live a life without leaks. So with that being said, would you share yours?
I guess, I just would leave with this point that, just because incontinence is common, we know that, over 60% of women in the US alone experience bladder leakage. It's not normal. And I think the more we can do to help women understand it's not normal just because it is common, and for them to understand that there are treatment options available. Don't wait to seek treatment. Relief is possible. And, it can sometimes be important to advocate for yourself and to be persistent. There really are a variety of treatment options, not just even the ones we discussed today, but other treatments as well, if those don't work for you.
Excellent. Those are great words to close out on. So thank you again. I really appreciate it. Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.